and welcome to the Vital Vibes podcast. What if the symptoms that you experience in your body are not random failures of the body, but intelligent signals asking you to pay attention? What if our current system of reactionary medicine and symptom suppression by medications is actually the opposite of true healing? What if your body is constantly communicating with you through symptoms, energy, and trying to keep your body in perfect balance? I'm Dr. Kelley Coble. I'm a biologic and restorative dentist with over 24 years in private practice. Along with my husband, Ian Coble, we will be guiding you on a journey to functional health. I'd like to introduce you to my husband, Ian. He's our producer, but more than that, he's here to facilitate and answer questions that are so important to helping patients understand the biology behind what we will be discussing.
Well, thanks for having me. I'm glad that I can be a part of this. I know I get to work in the dental practice with you on a daily basis, and I sort of serve as office manager, but also the patient relationship person to kind of help explain and kind of bring the human element, I guess, into the clinical side of things. Like, I don't know if that's a good way of describing it.
I think so. Honestly, my job as a clinician is to really work with my patients on helping them understand the disease process. And I love science, but I do get bogged down by the science. So having Ian in the practice has been imperative,
I
really.
I hope I can help steer the ship a little bit. And I know that sometimes we'll have conversations and you'll get very into the science of it, and I'll be miles in the background in the dust trying to understand. So I think I can try and help in a little bit of that. And I know there'll be people that are out there that are like, no, 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 more details, more details. And hopefully I can also represent the population that's out there like, hey, can you slow down a little bit and explain that a little bit more to me? So um thanks for having me. I don't know, tell us a little bit about kind of your history. Where did you start? What was school? What were the roots of dentistry for you?
It's been a great journey. I actually started as a sterilization technician when I was in high school. Um, I had a great mentor dentist. I worked in his practice, and he was the kind of mentor who was never like, this is just a job. He always encouraged me to explore deeper and to look further. And he always asked me, like, why don't you, just go to dental school? And I thought, well, that's silly. I'm going to be an accountant. So I took accounting, and I think I got a D. And then he's like, well, why don't you just take a biology class? And so I did, and I got an A, and then I took chemistry and I got an A, and then I was off and running. I'm like, this is my passion.
This is your calling.
This is it. Yeah. And I had someone encouraging me along the way and telling me to reach for the stars. Like, go for it. Whatever your passion is, that's follow it, because that energetic pathway is there for you to follow. And so I did. And in 2001, I graduated from dental school.
Where'd you go?
I went to Creighton University,
Where's that?
Omaha, Nebraska.
Thank you.
And I can't imagine, honestly, a better experience on some levels, as far as like it being such a warm and welcoming community, and the school really encouraging the dentist to like do all the things. So when I went to school, we didn't have someone to do the root canals. We didn't have someone to do the surgery. It was us. And
You guys learned from day one, like you were going to become a jack of all trades.
from day one, like
Yeah.
whatever walked in the door, my first patient was a molar root canal. And they didn't leave you to burn. they were there to guide you all along the way. And when I graduated, I was so grateful because I wasn't afraid of any of the procedures. Like I'd done them. And I see some of my colleagues who had not had the opportunity when they were in dental school. And I was just like, wow, I know so much about so much. And I think that really helped me like get curious about even more. And so I never knew like how diverse this career would become when I was starting. But I decided to go back to Seattle, and I actually ended up taking over for my mentor in his practice. And I ended up taking over his practice in 2006.
Okay.
And at the time, I had a 2 year old and a newborn. So I had no idea
You
what I
didn't have
was
enough to
getting
do. You
into.
needed another hobby or another log on the fire.
Absolutely. And I had no idea at the time where it was going to lead me. I thought I was just going to be a tooth doctor. That's what I was trained to do. And what I got was so much more than I could have ever imagined.
Well, I know um, Dr. Randall's practice, correct?
Yeah.
Um, his practice was set up differently than the practice that we have today. It was more, was it general dentistry?
Yes, it was general dentistry. It was, what I would call tooth dentistry. He cared very much for his patients. He would go to lunch with at least like one patient a day. He had these great relationships and he saw families over the years, and he had such a wonderful, way about him. But it was traditional dentistry. It was tooth based. But he was starting to transition when I joined, and he took me to some study clubs where we were starting to learn about what I would call more comprehensive dentistry.
Okay.
And he was introducing me to specialists who were really stretching the limit of traditional dentistry, and they were starting to look at the organism as a whole.
Okay.
And I think if he, were alive today, unfortunately, he's no longer with us. I think he would really be pushing and looking at things like we're looking at them differently now.
hmm Um, so when you took the practice over, was it sort of an instant transition into a more holistic, or how did it evolve as you took the helm from him?
No, it was definitely not an instant transition. One of the I think one of the big things that happened was I had suffered from TMJ, which is temporomandibular joint disorder, all through undergrad and grad school. And if anyone's ever suffered from it, they know how uncomfortable it is. It's constant jaw pain, sore teeth, headaches, and there weren't a lot of treatment options available, especially treatment options that I could afford.
hmm
Um,
I think you said something to me when we've discussed it in the past, where everything was sort of like, this is how you can kind of manage discomfort or mask uh, what you're feeling rather than kind of getting to the bottom of it.
yeah, I call that reactionary medicine.
Okay.
We're treating symptoms, and that's very common in our, I guess, Western medicine. So I was told take ibuprofen, which I did for over 10 years. Unfortunately, I took ibuprofen constantly. It helped. It didn't, you know, fix the problem. If anything, it made other problems for me. But symptom management was all there was.
hmm
And honestly, when I went to get treatment, I started to see that there was this like, um, because mostly women get TMJ, and there's a reason for that. It has to do with the estrogen receptors in our jaw. Women have much more of them. So it was seen as a like women's mental disorder.
hmm
And that's what was out there. And
That was a science of the time.
Yes, and as I've practiced now for over 20 years, I've talked to so many women who are like, "I was dismissed. I was told, you have a nervous disorder, you have a psychological issue, and instead
And
of
we can't help you.
we can't help you.
Yeah.
You need to take a Valium or
Hmm.
um I just I felt like something was missing from my traditional training. And so I wanted to learn more. I got very curious about TMJ and I went out and I just learned as much as I could. There was no one doing it. No one wanted the TMJ patients
Hmm.
because they were hard at the time, considered hard to treat. Still to this day,
Difficult cases.
difficult cases because they're multifactorial, because we are multifactorial beings. And what I learned is like the TMJ does not work in isolation. It's not just a mechanical joint that is in a mechanical person. Um, and that started me thinking like there's so much more to our body than just the mechanics of it.
Hmm.
And I need to look deeper. And once I started looking deeper, I could not stop. And I realized that a lot of the training I had, while like super great for cavities and other like mechanical ish
Hmm.
things, was really lacking um, when we're looking at the whole system and the energetic beings that we are. So yeah, I had to find a way to do something different because it just didn't resonate with me.
Yeah. So you kind of went from general dentistry, you started seeing that there was a bigger thing going on with the whole body as it related. I mean, it manifested in you in TMJ, TMD, uh, and that's, I think, kind of progressed the way the practice has grown over the years. Is that kind of accurate to say?
100%. Um, I started to see it more as a system, and it really led me to do a lot of restorative dentistry because a lot of my TMJ patients had severe breakdown
Hmm.
of their teeth and the supporting system in their jaw. So I started doing a lot of restorative dentistry where I was rebuilding the patient's bite. And when I did that, I noticed a couple things. Like I noticed their neck pain went away. I noticed their posture improved. I started to see that the bite was so connected to the rest of the body. And that just led me down a path of, okay, what else is connected here? So, yeah, I started my practice as a general dentist. I got curious about what was missing from dentistry. And then I started to make connections of once I did something, what was the effect of that on the whole organism? And I was just really surprised at what I found.
Yeah, I think um, it's just gotten to be more whole body and biologic focus. The longer you're in practice, the more it goes further and further and further in that direction because the more you kind of um, continue to learn, the more that you continue to see, the more just the evidence is there that this is all connected.
The evidence is there. We're not machines, mechanical machines.
Yeah.
We are quantum beings. Everything from what's around us, inside of us, um, affects affects the system as a whole. And if you're not looking for all the connections, you're missing a huge part of helping people get better.
You said something to me when we were first talking about doing the podcast, and this conversation's been going on for years, I believe. But just sort of, and I wanted to visit that a little bit with the listeners was that when you went to dental school, you're kind of isolated from the rest of medicine. That the rest of medicine, be physician, surgeon, whatever specialty, they all go to med school together and then they go and do their specialty. But dentists from day one are in this little cubby off to the side that it completely doesn't communicate. I'd love for you to share a little bit about that because I thought it was kind of a really fascinating um, insight to the current kind of medical system that we have in North America and probably globally.
Oh, it's fascinating. Health was never meant to be fragmented. You can't separate the teeth and the oral biome from the rest of the body. I know when the separation happened, like in history, and how that all started, and we can talk about that on another podcast.
Absolutely.
But we are whole organisms, we are whole beings, and medicine should have never been separated from dentistry in the first place. I mean, the oral environment is such a window into the health of the body. The fact that like we are separated initially right away in school, it's no longer efficient, and it just doesn't make any sense at all.
Hmm. Well, thanks for that sort of, insight into your past and, training and everything. I guess um before we kind of dig into a little bit about, what Vital Vibes, what this podcast is, um I think it would be really nice to hear a little bit about, who you are, what experience you bring to the table, not just from a clinical side, because, we talked about that, but I think so much more than that is we are all humans, and that really shapes the way we view the world and what we bring to the table. It's our values, it's our optics, what who is Kelley Coble? Like what are the things that light your fire, that fill your cup, that bring you in front of the microphone and um
Oh my gosh.
get you going in the morning?
Yeah, I'd love to share that because I feel like honestly, all these like hobbies I've taken up and these experiences I've had, they all have led into the same perfect direction. And they all come into play in this podcast. I mean, I'm a wife and I'm a mother of three. And there's so many things that I've learned through that experience that, I'd love to, that I bring into my practice that have helped me understand humans and the human journey. I mean, a couple of years ago during COVID, I decided to take some classes on herbalism just to pass the time. And honestly, what I've learned through herbalism has been just as important as what I learned in dental school.
Hmm.
I've had great mentors in the health industry through CrossFit and Olympic lifting. And those things have taught me so much about the human body that I would have never known had I not done those. So, all my hobbies, and there's a lot, way too many. I mean,
List.
and
We don't
even,
need a resume of hobbies.
but even the travel, like my husband and I love to
Yeah.
travel. We've learned so much from traveling the world that I'm going to bring into this podcast. So, hobbies are no accident.
No, and I think they're an important part of who you are and what you're bringing to the listeners, because it shapes how you see things.
Well, my weirdest hobby, which I also got into a lot more during COVID, well, one of the weirdest
I
ones
was
was,
gonna say, like, this will be interesting.
well, I'm going to talk about physics for a
Oh,
second.
there we go.
Yeah.
Okay.
I mean, I got all these books on quantum physics. I'm just fascinated with quantum physics. And now, I mean, we are just beginning to understand how quantum biology and quantum physics work in the human body and the connection. I mean, our body is so intelligent and it uses these somewhat seemingly complicated pathways to communicate, but that little hobby has helped me understand more about the systems working together in the body than almost anything else.
Yeah, which is crazy. You wouldn't think that, especially if you're just thinking from like a traditional perspective of
Mm.
like, well, but you're a tooth doctor,
Yes,
and it's like, no,
there's some physics here
there's a lot going on.
and not boring physics,
No.
fascinating physics. And I've traveled with different groups with herbalism as well. Like I've been to Costa Rica with an herbal group and just learning the way that the medicine affects our bodies. It just, I can't wait to bring it all together.
Yeah.
And I feel like this accumulation is just the right time.
Yeah. Well, speaking of that, like what made you want to to start all this? Because I think I kind of alluded to it in an earlier comment. Like we've been discussing this for years. I know, you know, this conversation's been going on for 4 or 5 years probably. And it could have been in your brain longer than that, and you just didn't bring it to my attention. But like what made you want to get on a mic and just start talking to people about all of this?
I mean, it feels like perfect timing.
Hmm.
Um, I feel like I have knowledge that has to be shared. And it's almost like bursting out of me.
Hmm.
And I don't want to contain it. I want to share it. I want to explain the things that I've learned. I think I'm fed up with traditional medicine in this country. I understand it's been very important
Yeah.
and helped a lot of people, and that there's a time and a place for it. But if there's anyone out there who's not frustrated right now, I think they're in the minority.
Okay.
There's more options, and exploring that interaction between science, biological dentistry, and lifestyle, I feel like I can bring something to the table that's missing. And I would love to see a change in how we approach healthcare.
Hmm. Not just in dentistry, but whole body.
Whole body, because remember, dentistry is not separate.
Yeah.
You cannot separate the mouth from the rest of the body,
Hmm.
and organs are not separate. And if you're getting treated for one thing, trust me, there are more things connected to that than one thing.
Hmm. I don't know if this is being redundant, but kind of something that you just said and making sure I circle back on it was just sort of when you were talking about TMJ and um, medication and the masking of symptoms. Um, I feel like that might be pertinent to what we're just, talking about here. Like, can you kind of elaborate a little bit on that?
I can. Let's
Not just to TMJ, but just in general medicine, not just dentistry.
a million times. Let's quit masking our symptoms and let's get curious. What is our body trying to tell us?
Hmm.
There's a message in every symptom. And if you're just shutting down the symptoms, you're not getting the message. And signs come way before symptoms. So, evaluating patients for signs of disorder, signs of disease long before symptoms come is to me so much more important than masking or covering up the symptom or the message that your body is trying to give you.
I know with dentistry and our patients in the practice, we'll have someone that'll be like, well, my tooth doesn't hurt. Uh,
Yeah.
and
Yeah, by the time it hurts, it's too late.
Mhm.
The
And
tooth is on its way out. Um, and and honestly, it's the same with the body. Um, the big diseases out there, they don't hurt.
mhm,
Cancer, generally speaking, is asymptomatic at first.
mhm.
So, symptoms are not a good indicator of disease.
But they
And
can minor symptoms could also be something trying to notify us
absolutely,
and to just shut that down with a medication that masks that symptom.
absolutely. With TMJ, like taking ibuprofen, yeah, that could help for a couple of weeks, but there's an imbalance in the body that needs to be addressed. And if you don't address these imbalances, the symptoms get louder and louder and louder.
Mhm,
And by the time they're really loud, we've got a big problem.
mhm,
So, learning to recognize the signs and the early symptoms to me is the key to helping patients who do have an issue to, get that issue solved quickly.
Hmm.
And we need to address it on all levels of the organism. I mean, there's a physical level, there's an energetic level, and there's a psychological level. And if you're missing any of those, you're missing the boat
Yeah.
because we are complex beings. But the answers are actually quite simple.
Okay. What sort of episodes can our listeners expect?
Oh boy. You're going to get it all. There's going to be episodes about dentistry. I mean, obviously
That's your specialty.
that's my specialty. We're going to talk about what I would call biologic dentistry. There's been some mistakes made in dentistry that have come to my attention over the years, and I want to rectify some of those and get people moving in the right direction. So we're going to talk about dentistry, teeth, airway. I'd like to talk about bringing in some Chinese medicine, um, meridians, you name it. Like the one of the most important things that I really want to bring to people's attention is the environment in which the organism that is you lives in. There is not one thing that's next to you that doesn't affect your health. And so just helping people realize, like, if you look to your left and you look to your right, are the things around you helping you or harming you?
Give me an example.
Um, I'm looking at my cell phone right now.
Hmm.
Is that cell phone helping your energetic system? Is it helping your body right now or is it harming you? And we'll definitely go into more detail about cell phones in the future. But what is next to you all day, every day? Is that phone being next to you in your best interest?
Hmm. Or Wi-Fi in the house, or
Yeah,
um,
I definitely want to talk about that. I have
yeah,
super strong opinions on that. I'm in the middle of um, a super unique healing opportunity with autonomic response testing. And, one of the biggest issues that we're seeing in my practice with the general population, and especially with my autistic patients, is the role of Wi Fi affecting the patient.
hmm. And that's, I think, just one level of it too.
It's one level.
Yeah.
So we'll talk about it all
Okay.
because everything matters.
Hmm.
And I don't think you can leave anything out.
Okay.
Yeah. So my goal is just to help explain the interaction between the science, the dentistry, and yeah, quantum physics. Mhm. And how we can live a longer, better, happier life. Um, where we're 100 and we are still vital.
Yeah. I think striving to get the best life that we can, that lasts the longest, that allows us to live healthy and well to a ripe old age. And, I think that's our goal. And how can we achieve that? And I think, when we've had our discussions, that's sort of what I hear is how can we maximize our life? What can we do to move the needle in the right direction, to be as healthy as possible for as long as possible on as little to no medications as possible? Um,
That's what Vital Vibes is about.
yeah. Living our best.
And I'm so excited to bring it to the front and to share it with everyone. I'm beyond excited. And I never could have imagined when I started back in 2001, I guess. And I don't think my mentor could have ever seen where I would take this.
Yeah.
But I know if he could, he would just, yeah, he would just be like, You're heading the right
Cool.
way." So
Nice. Well, I think I just want to say thank you for bringing me along on the journey, because I never would have guessed that this is where I would be sitting. If you talk to 21-year-old Ian, I don't want to date myself, but yeah, that would have been a long time ago. And to be sitting here having these conversations, I'm also very excited to have this as part of my life, part of my journey, and to be able to hold these conversations that we're planning and that we can bring to our listeners. And I think that's really exciting. And thank you for being the, lightning rod that made all of this happen. So
Well, I couldn't do it without you.
thank you.
So thank you for joining us. We just can't wait to share our next episode with you. We're planning on releasing episodes weekly,
Mhm.
and then more if needed. So tune in and join us on this beautiful journey.
I'll be sort of the point person for the podcast. I will link our email in the description at the bottom of the episode. If you have questions for, do we call you Dr. Kelley? Do we call you Dr. Coble? What would you like to be,
It's
or Kelley, or how did you prefer to be addressed?
it's so funny because I practice under my maiden name,
That's
Dr.
correct.
Kelley Fisher.
So if anyone's
Um,
Googling,
yes, yes, it just seemed complicated to change the name of the practice after I got married. So I'm still under Dr. Kelley Fisher. But for this podcast, I mean, I think Dr. Kelley is completely appropriate, and that's where I want to be.
so I'll be kind of the contact point if our listeners have questions that they want addressed, they have ideas for the clarification, whatever it is, send us an email or leave a comment, and we'll try and make sure uh, we get those addressed, and maybe we can have some Q&A style podcasts that address some of those on a, rather than just peppering them in from here and there. So um,
Fabulous.
yeah, well, awesome. Thanks so much.
Okay, thanks everyone. We look forward to seeing you next time.